So next, Danny and I are going to go over a couple of tips on how to make it comfortable for a cardiac stress test. Now this test, it's very, very important that there is no motion whatsoever. So whether it's arm motion, breathing motion, even moving their legs around, if they're thin enough, it can move their chest around as well. So we're going to go over a few tips on making someone nice and comfortable to get a good, accurate test for a cardiac stress test.
So when positioning a patient, it's important to give clear instructions. So I'm going to demonstrate right now. Okay, Jackie, I'm just going to have you sit right here, and your head's going to be on this end, and you're going to be flat on your back, and your legs are going to be down here. Okay, that'll help you. You want to scoot forward a little bit. Yep. I want your chest nice and flat for the picture. And I got this pad to put under your knees, and it'll take pressure off your lower back.
Oh, good.
Okay.
Actually, it hurts a little bit right now.
Perfect. How does that feel?
Can you move it down just a little bit more, please?
Yeah.
Thank you. Oh, perfect.
Okay. And you also notice that I put it under the sheet because if they had shorts on, you don't want that on their bare skin because it could hurt their skin, or it could also have a bigger chance of contamination. And for this test, we're going to have you put your arms above your head. Okay, that's perfect. And would you like me to put some padding under your elbows? It might take some pressure off your shoulders.
Oh, yeah, that'd be great.
I'll grab that for you. Are you cold at all? Would you like a warm
Yeah, it's
blanket?
freezing in here.
Yeah, the cameras have to stay pretty cool in here, so that's why it's
Why do
cold.
they have to stay cool?
So this camera here, we use a crystal, and we need to make sure that it's dry and cool so it doesn't get damaged,
Oh.
so we can have good pictures, okay?
Nice.
So I got you a blanket here. Should be nice and warm
Ooh,
for you.
I like that.
Good, does that feel right? Feel good?
Perfect.
I'll put this around you. I got some padding for you as well. Just gonna roll this up. I'm gonna put it under your elbows here. Does that feel a little better?
It does.
Okay. There we go, and then the other elbow. Does that feel alright?
Mm-hmm. No, it's really
Okay.
nice.
And then when we scooch you forward, we're going to lose these side rails, so I'm just going to wrap this around you.
Okay.
And it also allows the camera to get nice and close so we can get the best quality pictures.
Okay.
Is that the
It's really nice.
It's nice?
I'm
Okay.
gonna fall asleep.
And I'm just going to raise the bed up for you, okay?
Okay.
And then right here we call it a P-scope. This is where we would, this is what we use to position the patient. But Jackie doesn't have any radioactivity or any nuclear medicine in her system, so I don't see anything. But with patients, that's what you would use. So
You
it's
know
like-
what? My shoulder's actually starting to hurt. Do you have anything else that would help my shoulders a little?
Yeah. So if
I'm
they-
sorry, I don't mean to be a pain.
Oh, it's not a trouble at all, man. So you could also place a pillow on their forehead if they continue to
that's
have
much
shoulder
better.
pain.
Yeah, I
Because
totally
they're
rotate.
like this instead of extending it real far, which will put more pressure on their shoulders.
Yeah, that's awesome.
Okay. Are your arms cold at all?
A little bit.
A little bit? Okay, I got this blanket here. I'm gonna place this over there.
Ooh.
Does that feel nice?
Yeah.
Okay. So you ready for the images?
Uh-huh.
Okay. And then slide them forward. So about there you would see the heart on the top of the field of view. And then I would just inform the patient, okay, so now we're ready for take the pictures. The camera will come close to you and rotate around you, but we have these sensors so it will not touch you. And it's just very important that you remain still as you can and just breathe normally.
Okay.
For us to get the best pictures, it'll be about 8 minutes long.
Okay.
And I'll be right here if you need anything, okay?
Okay.
We're going to start right now.